Welcome to Brain Boosters platform. In this presentation, I'll be discussing nursing care of a patient with mania. This is the layout of the management. This is the layout of the nursing care. You always have to begin with your aims, then you go to the environment. You need to talk about maintaining safety as well. Building a therapeutic relationship is important because we are trying to maintain safety. Our client is very hyperactive because they have too much energy, and sometimes the client may be paranoid, they may have psychotic features, so we just have to maintain safety. Okay, we need to really put in some preventive measures. Also, building a therapeutic relationship, because of the paranoia that the patient may have, they are easily irritable. We need to make sure that we create this therapeutic relationship with the client. Okay, this will help us build trust. Providing psychotherapy or psychological care is very important as well. It's a form of counseling that you give to your client with mental illness, and it may be very effective in a patient with mania as well. Very effective in a patient with mania. Promotion of a good nutritional status. Our client may not have time to feed, may not feel the need to eat, so we have to help them because they will be at risk of malnutrition. We have to make sure that we attend to this need as well. Observations. It's important that we observe the client closely because the client, because of the risk of injury to self and others, we also have to observe whether the client is improving or not, and also just observe to help rule out any abnormal behaviors before they become serious. Okay. Assertiveness training. Every patient suffering from any mental illness, they usually need to be trained on how to be assertive. Okay, it's either the client is aggressive or they are too passive. Our aim is that the client should be assertive because that's the desired way of behaving and conducting oneself. Right. Medication. It's important that we also attend to medication as nurses. We have to administer these medications as prescribed, and also this medication also helps deal with whatever psychotic features the client has or whatever symptoms that are very troubling to the client. Medication will actually help stabilize the client. Okay, a patient with mania will obviously be on mood stabilizers and anti-manic agents. Promoting good sleeping patterns. This is a patient with mania. This point is very important that we discuss it. So patients with mania may suffer from insomnia. They may not feel the need to sleep. So we have to make sure that we help them have enough sleep also. Social therapy. Sometimes clients may be having difficulties when it comes to socializing, maintaining their interpersonal relationships. Their relationships may begin to suffer and all that. So they may need help when it comes to socializing. Okay, so we need to talk about social therapy. We need to give or subject the client to social therapy where they'll be reoriented on how to conduct themselves in public so that they may be accepted by people out there, and also for easy integration into society. Okay. Behavioral therapy. The behavior of a client may be the one leading to alterations in their personal interaction with others, okay, or their social life. If the client's behavior is considered bad by other people, people may decide to avoid these patients. Okay, if, for example, if the client is showing some violent behaviors, aggressiveness, and all that, people will run away from the patients. They will not desire to be in the presence of this patient because uh, they are trying to protect themselves against him. So, helping the patient change his behavior to a behavior that is acceptable in the society will be very, very important for the client's healing, okay, and reintegration into the community. Group therapy very important because during these therapies, the client will learn a lot from other patients. They'll be motivated, they'll be encouraged, they'll give each other goals to meet. And so group therapy is very important because it helps the clients to get reintegrated into the community at a faster rate because they'll learn more from their friends, okay, and by so doing, by being involved in this group therapy, the client will gain that self-esteem that we need to build in him. Okay, family therapy is very, very important because they are also affected. If the client is sick, the family is also affected because they are the ones who are going to be spending a lot of money on this client. And sometimes they'll be sparing their time taking care of this patient and all that. So the client needs to be taken care of. The health of the family must be handled also by the nurse. So you need to involve the family from admission up to the moment the client is discharged. Right, so the family is the primary healthcare giver to the client. After discharge, this patient will go back to his family. So if the family is not trained, the family is not oriented, the family is left out, is not fully involved, the client may be readmitted before his time for review even comes. So we need to train the family. They have a huge role to play, especially in preventing readmissions of these psychiatric patients to a psychiatric hospital. The last point I'll talk about is IEC. So we need to give information, education, and communication to our client and the family. So we'll discuss this as well. So upon discharge, we need to make sure that we give this information to the client to help them know how to handle themselves when they are at home, and to emphasize on important points on medication, on drug adherence, on review dates, and everything. Very important. Okay, there are a few points that have left out here. Another point that you may talk about here is cognitive therapy. Cognitive therapy I've not mentioned it here, but some people call it CBT, cognitive behavioral therapy, right? So if you like, you can talk about cognitive therapy because I've written behavioral therapy, so you can talk about cognitive therapy. If you have not written behavioral therapy, you can say cognitive behavioral therapy. It's okay. You can also discuss that under patient with mania. Cognitive therapy, we are talking about it. We are discussing it under mania because these clients may be paranoid. They may have psychotic features. So they need that help from us as healthcare providers to get back to reality, okay? To view the world as it is, to get out of their fantasies and view the world as it is. All right. I think for now these are the points I'll discuss.
Watch out for part 2 where I'll discuss the nursing care interventions for each of the points I've mentioned above. Alright?